Severe obsessive-compulsive disorder is more than just a behavioral habit. For those living with it, the mind is locked into a loop of intrusive thoughts and forced rituals that they physically cannot stop. It is a massive public health issue. With a lifetime prevalence of up to 3%, OCD is the fourth most common psychiatric diagnosis, affecting millions of people across every demographic. The burden is compounded by other severe conditions. Patients frequently struggle with comorbid depression, panic, delusions, and suicidality, making the disorder a high-stakes medical challenge. Ultimately, this is a chronic and debilitating disease. It places a staggering burden on human life, often preventing people from working or maintaining relationships. The current medical standard of care relies heavily on serotonin reuptake inhibitors, or SRIs, often paired with cognitive behavioral therapy. But those standards are far from a cure. This chart represents the efficacy of those treatments. As you can see, between 40 and 60% of patients fail to respond to these drugs. While clinicians struggled with these outcomes, a series of anecdotal reports began to surface. Individuals using psilocybin mushrooms recreationally were reporting a sudden, complete remission of their OCD symptoms. For these reports to be taken seriously as a medical option, they had to be moved out of the realm of stories and into the rigors of a clinical trial. In 2006, a research team at the University of Arizona, led by Dr. Francisco Moreno, set out to test these reports in the first-ever study of its kind. They selected 9 subjects who were already in the depths of treatment-resistant OCD. Every participant had already failed at least one, and in most cases several, standard SRI therapies. Safety was the primary concern. Sessions were conducted in a controlled outpatient clinic for 8 hours, followed by mandatory overnight observation for each patient in a psychiatric inpatient ward. The team used an escalating dosage model, blinded and randomized. Subjects were given very low, medium, and high doses of psilocybin to map out exactly how their bodies and minds reacted to the compound. The substance proved to be physically safe within this clinical framework. The only significant side effect observed was one transient case of high blood pressure that resolved on its own. With the physiological safety established, the researchers could focus on the most important question. Was it actually working on the OCD? The researchers used the Yale-Brown Obsessive-Compulsive Scale, or YBOX. This is the gold standard metric doctors use to track the severity of obsessions and compulsions. When they analyzed the data, the results were striking. Every subject experienced a massive drop in symptoms, with score reductions from 23 to 100%. This relief lasted well past the drug's expected active life, remaining present 24 hours later, and for some, lasting weeks. The researchers also encountered a dosage paradox. They included a very low dose as a non-hallucinogenic control, but even this small amount triggered a significant therapeutic response. Furthermore, they found no correlation between the intensity of a subject's trip and their clinical improvement. Patients achieved relief regardless of whether they had an intense hallucinogenic experience. This suggests that psilocybin's medical benefit doesn't rely on the high, nor does it follow the slow buildup pattern of daily pills. The researchers hypothesized that this rapid, lingering relief is caused by an adaptive cascade. They suggest the compound may trigger the brain to quickly downregulate its serotonin receptors or initiate changes in gene expression. This is an important step forward, but we have to remember the scale. This was a 9-person proof-of-concept study. It is not a recommendation for unmonitored self-medication. The next step is clear. These results justify the need for much larger, placebo-controlled trials to confirm these effects and determine the optimal long-term treatment plan. By supporting clinical research into these compounds, we can move closer to providing a reliable lifeline for those whom traditional medicine has left behind. A peaceful mind should be a possibility for everyone.